Individuals who experience dizziness if standing from their seats should be examined for orthostatic hypotension, OH. It is not simply dizziness, but can indicate a larger health issue. Therefore, caution should be exercised. The onset of OH is associated with a change in posture, as it emerges if standing and vanishes if sitting or lying. The symptoms included dizziness, fainting, blurred vision, neck shoulder discomfort, chest pain, and shortness of breath. We believed it was only dizziness. However, there were other symptoms. It occurs if the systolic blood pressure decreases by more than 20 or the diastolic blood pressure decreases by more than 10 within 3 minutes of standing from a seated position. It affects approximately 5% of the population. Contrastingly, type 2 diabetes has a prevalence of only 30%. OH is the most evident manifestation of autonomic nerve control failure. What causes OH? Gravity sends zero point 0.5 to 1 liter of blood from the chest to the lower extremities if sitting. The pressure around the legs increases by 10% as the pressure in the blood vessels of the lower extremities increases. This decreases the amount of blood returning to the heart. If you wake up, you may experience symptoms because there is insufficient blood flowing to the heart or head. Central or peripheral OH occurs if an autonomic nerve fails. If standing, sympathetic nerve cells must release a sufficient amount of norepinephrine to sustain peripheral vascular resistance. However, this function does not work properly, resulting in OH. OH is concerning because it is associated with several disorders such as aging, diabetes, higher blood pressure, and Parkinson's disease. OH increased the overall risk of death by 1.5 times. Coronary artery disease grows 1.4-fold, heart failure grows 2.3-fold, and stroke grows 1.6-fold. Patients with OH have a 1.5-fold greater chance for developing dementia because of the decreased blood supply to the brain. Therefore, what should be conducted if you have OH? 7 practical tips can be provided. First, conditions that could result in OH should be avoided. Examples include hot outdoor temperatures, hot bath, anxiety, holding your breath, abruptly rising from a lying or sitting position, and overeating. Second, physical manipulation is required to raise blood pressure if OH occurs. Bending the head, crossing the legs, or raising the stomach pressure, particularly huddles or crouches. These physical positions improve the cardiac output, blood pressure, and cerebral blood flow. However, it is vital to remember that OH symptoms may reappear if the patient returns to a standing position. Third, increase daily physical activity and exercise. OH can be exacerbated by decreased cardiorespiratory function and physical fitness. Reduced blood flow due to changes in the anatomy of the left ventricle causes OH, which can be restored by increased physical activity and exercise. OH can occur up to 3 to 4 times more frequently in the elderly aged more than 75 years if sarcopenia is present. Thus, stress strength training and protein intake are considered alternatives. Fourth, healthy diets were maintained. Avoid overeating and limit carbohydrate consumption. Avoid hot food and alcohol. You must avoid exercising immediately after eating. Some medications may have caused OH. Examples include diuretics, blood pressure drugs, prostate enlargement medications, Parkinson's disease medications, and antidepressants. Consult a doctor if OH occurs while taking these drugs. Using several drugs can further increase the risk. 6. A suitable amount of salt should be regularly consumed. An adequate blood volume is required to maintain an orthostatic posture. It is recommended to ingest at least 3 grams of salt daily to improve blood volume. Salt is believed to be an enemy to health, and if excessively avoided, it can be harmful. Seventh, it is suggested to drink 2 to 2.5 liters of water daily. There is also a method for swift drinking of water as a first aid. It can assist in consuming 500 milliliters of water, the equivalent of a bottle of mineral water, within 3 minutes of the onset of OH symptoms. Drinking water enhances norepinephrine activity in the blood and activates sympathetic nerves in the muscles. We discussed the deadliness of OHs and its prevention and management. If you have experienced OH, we hope you will practice the tips provided and maintain your blood pressure.